Hey there, podcast family. In today's episode, we're diving deep into postpartum health with my guest, Alison Boden, a functional dietitian and a passionate advocate for helping moms reclaim their vitality and well-being after childbirth. In my conversation with Alison, we explore what led her to specialize in postpartum health and establish her platform, Motherwell Nutrition. We uncover the hormonal changes that occur immediately after birth and during the postpartum time, shedding light on how they impact common symptoms like mood swings, hair loss, anxiety, brain fog, and night sweats. Alison also shares invaluable insights into the nutritional needs and awareness required in the postpartum period, debunking harmful societal narratives around losing baby weight and bouncing back. Moreover, we delve into the unique challenges faced by women navigating both postpartum and perimenopause simultaneously, offering practical strategies for finding hormonal balance amidst the chaos of motherhood. Alison sheds light on the often overlooked gap in discussions around postpartum nutrition, especially between 6 to 18 months postpartum, when she feels moms need the most help but don't consider themselves postpartum anymore. With her wealth of experience as a mom and a dietitian, Alison provides real-world strategies for mothers to navigate postpartum nutrition effectively, empowering them to replenish their bodies, balance their hormones, and feel their best again after giving birth. Please feel free to share this episode with anyone who you think could really benefit from this information, and come find me on Instagram and let me know what you thought of it. Hi, Alison. Thank you so much for being on the podcast with me.
Hi, thank you so much for having me. I'm really, really excited to dive in.
Oh, same here. I know, right? When I saw all of these talking points, I was so excited because I really don't feel like we cover this enough. This conversation specifically, that postpartum window and how long it actually is.
Mm-hmm.
Especially when you think about the fact that doctors are like, okay, it's 6 weeks, you're good to go. You can do
Yeah.
all the things you did before. And I would
Yeah.
say that the majority of women are like, no, actually, that's
Right.
not how I feel.
Not ready to go back to work, not
No,
necessarily ready for sex. Yeah. All of the things, right?
right? Yeah, don't even go anywhere near me down there.
Yeah.
It's what some women have said to me.
Yeah.
So I would really love to just get into a conversation with you about what brought you to this work. Like, how come you became a dietitian that specializes in postpartum health? What led you to found Motherwell and all of the things that you do now?
Yeah. So I'm Alison Boden. I have a master's of public health in nutrition from UNC Chapel Hill. And I started my private practice interested in hormonal health, particularly fertility. I had lots of friends that went through fertility struggles at an age where it shouldn't have happened, And so I started to understand hormonal health as it related to things like fertility, PCOS, amenorrhea, and that area. And then so I saw lots of pregnant people, lots of fertility hormone symptoms, and postpartum never crossed my mind as something to go into. From all of my years of study, from like the more traditional dietetics to continuing education that I've done in more of like the functional medicine world, holistic type stuff, the women's hormonal health timeline would go like fertility, PCOS, pregnancy, lactation, menopause. And so I wasn't really aware that there was this whole gap that none of my studies was really covering. And so, like most stories, it was my own experience that really informed that there was a problem to be solved. So my kids are 6 and 8. During my first pregnancy, kind of understood a bit about how the prenatal and pregnancy guidelines weren't quite so great. A lot of what not to do, but not a lot of what to do. But then after I had my first, completely unprepared for what was happening hormonally, recovery wise, and how long my symptoms could linger from things like night sweats straight out of the gate that almost every new mom experiences, but I had heard nothing about this, even from any of my friends, to things like brain fog by the time I was getting back to work and really bad exhaustion. My baby slept through the night relatively early, but then I was having insomnia. And so I was like, what is going on? And what can I do about it? And so I just started to like look into the literature about what was going on, because I didn't get this information from any of my studies. It wasn't well-known information, and there weren't a lot of people talking about it like on social media. Not that there's like a ton now, but at least there's some. And so I like figured out what was happening hormonally and did some tests on myself and started to just eat in a slightly different way, got a couple of supplements on board, and I started to feel a lot better. And then I started to become aware that a lot of people are experiencing really similar symptoms, and started treating more and more new moms in this kind of same nutrition journey that I brought myself on, and found that it really worked time and time again. And so I started to write more about it on my blog. Lots of people were resonating with the information, and just found that this was my niche, this was my gap, and this was, my patient population. And so here we are today.
Here you are. I know. First of all, I just want to say that it's amazing when you've studied health and you have an understanding of it, and still you're so caught off guard. I feel like I've heard that from so many practitioners. So then you start to think about someone who doesn't know any of this nutrition stuff, and this is not their forte at all. And you just know what they're going through. And also something else that you said that really struck me was the fact that none of your friends told you about all the symptoms that they experienced, because I feel like we have just, maybe it's that we just have such low expectations for our health at any stage of the menstrual life cycle, that we are just, we don't even talk about them because you just kind of think it's par for the course.
Yeah, exactly. And I didn't have like too many friends that had close friends that had babies before me. But you better believe that my friends that had babies after, like knocking on their door with their care package coming through, to help prevent what happened to me. But yeah, it's things that not a lot of people are talking about. And there's a lot more, circulating in the postpartum space right now, particularly postpartum mood disorders. And people are speaking out about experiences and getting, treatments that maybe people that weren't getting treated before, because they didn't know that what they were going through was something that could be helped, And so I think that there's a lot of bubbling up in this postpartum space right now. That's really good. And I'm trying to also bring the nutrition talk to the surface. And then as I'm getting older and as my patients are getting older, I'm starting to get more into the perimenopause space for moms, and really seeing the connection between somebody who maybe didn't, fully recover from pregnancy and postpartum, hormonally, nutritionally, and then seeing how that plays out in the next hormonal transition. And so I really think that like perimenopause prep starts in postpartum, for those that have kids. And so it's all really related.
Oh, it totally is. I know. We're going to get into that. I want to talk more about that, because that's such a thing. And I just feel like perimenopause is challenging enough as it is. Right? Just add those two together. Perfect storm.
Yeah.
But I would love for us to just sort of get back to the basics and talk about what you termed the postpartum hormonal cliff, and just talk about the hormonal changes that occur maybe immediately after birth, and then, throughout the postpartum window, because we're going to talk about what that postpartum window looks like as well. But I would love for us to talk, maybe first we'll start with like the immediate changes that happen hormonally after birth, and then we'll get into what then changes after that.
Yeah, definitely. So at the end of pregnancy, your hormones like estrogen and progesterone are the highest they will ever be in your whole life, right? And then you give birth, and within like 5-7 days, they slam down to menopause levels. Okay. And, talk about something that's like
so
happens physiologically. I know, to everyone, and nobody talks about it. And I think I heard this originally from Aviva Ram. She stated that hormonal change, the hormonal cliff, is the most significant and fastest hormonal change any human can experience. So like,
let's let that sink in.
right?
Yeah.
Flashing back to all those symptoms in those stages and like, yeah, of course you felt like that, right? And so that, you have menopausal levels immediately after birth. And then that next year or so like your body is kind of trying to go through puberty again. So you have this like rapid shift to menopause levels and then this like course correct to try to go back, right? And then things like breastfeeding are going to impact this really heavily, right? So when prolactin rises, it suppresses estrogen. So in somebody that's breastfeeding, they're not going to be ovulating for a while because estrogen is so impacted. And then, of course, if they're not ovulating, they're not going to be making significant amounts of progesterone. And so that kind of low level, postmenopausal-ish level of hormones can last the duration of breastfeeding for a lot. It's a real crapshoot on when somebody might get their period back after birth if they're breastfeeding. Some get it 3 months postpartum. Some might not get it until 18 months postpartum if they're still breastfeeding. So a lot of variability there, but that really impacts how well these hormones are going to come back up, right? And then we add in lack of sleep, stress of new baby or adding another baby to the family, stress like no maternity leave in the US, all of that, lack of support, throw in some diet culture pressure to lose weight. And these hormones really struggle, right? And a lot of the symptoms are related to that, or like a perfect storm of all of the above.
Right. And then what about, going into pregnancy, being so stressed and nutrient deficient and maybe having gut health issues or thyroid problems? I feel like so many women are going into pregnancy depleted as well, that I imagine that has a significant effect on what happens post-pregnancy.
Absolutely. And we have this myth that I refer to as like the abundance myth of pregnancy, where we grow physically in pregnancy, right? You gain weight, a lot of that is baby, a lot of that is blood volume, breast tissue, a lot of that is fat, right? And so we come out of pregnancy thinking like, I'm good. Like I'm topped off. I took my prenatal the whole time. I ate a little bit more or a lot more in some cases, right? And so I'm like good to go back to just what I was eating before. But in context there, especially if pre-pregnancy, somebody has significant nutrient deficiencies, might be a little hormonally depleted prior to pregnancy, they come out of that worse for the wear in a lot of cases. And I find I run nutrient tests, like comprehensive nutrient tests on a lot of my new moms, and it like lights up like a Christmas tree. There's so many some straight nutrient deficiencies and some just like borderline low levels. And that baby during utero really requires a lot of nutrients. And if we're not getting that from outside sources, from diet, from a good quality prenatal, your body just gets pillaged. And so a lot are going into pregnancy depleted, coming out of pregnancy even more depleted. And then we don't hear anything about what to eat for postpartum recovery and all of the nutrients needed for healing, for supporting lack of sleep, high stress, all of that further depletes us. And then 18 months later, like, why do you still feel so bad? And it's really because of all of that coming together just leaves moms more and more depleted.
It's insane when you think about it. It's exactly what you said there, that there's so much, it's coming at us from so many different directions. I feel like just hearing you, I feel overwhelmed just thinking about the potential for being deficient in so many ways, prior to pregnancy, during pregnancy, and then post pregnancy. And there's such a lack of the support system like you described as well too, which is, I feel like, majorly exacerbated in our country because of the lack of maternity leave or paid maternity leave laws.
Right.
Right. So we could go on, but Okay, so can you talk a little bit more about the symptoms that someone would experience like right after birth and then, in the window, the postpartum window? And also maybe can you tell us like what the postpartum window is again, just so that everyone's clear? Because like you
Yeah.
said, right, that there's some misunderstanding about it. Like, is it just the first 3 months or is it 6 months or 12 months?
Yeah, yeah. I like to think of it in layers, but
Okay.
if you look at the actual medical definition, most medical texts will say it's 6 to 8 weeks, which like, oh, how convenient, because that's when you have to go back to work in a lot of cases,
Wow.
right? Or when the
Yeah,
paid
no
leave,
kidding.
if you
No
got any
kidding.
paid leave at all,
Right.
often that's when it expired for me.
Wow.
And so that is a point where there's going to be some resolution of some healing, like tearing often is healed by that point. The where the placenta detaches from the uterine wall is typically pretty much healed by that point. And so that's like kind of one layer. Then you have the fourth trimester, which is first 12 weeks. I think that is another layer of when things start to get a little bit better. But in general, I think of postpartum as 2 years. And that's about how long it takes, if you're not working really hard on it, to replete a lot of these nutrient stores. Like the World Health Organization recommends 2 years between pregnancies, actually for this reason, for replenishing nutrient stores. And
So
so
2 years
that's
from the
really
time you
important.
give birth to 2 years to the time you get pregnant the next time, right?
Yes,
Okay, right.
that's their
Okay.
official recommendation, which I agree with. Now, you paid attention earlier, my kids are 6 and 8. So there, I didn't quite listen to those guidelines. There's, of course, a lot of things involved in making that decision, and that decision is not always an on-purpose decision, right? But I think if you that is the timeline I generally recommend, and if you want to do anything earlier than that, want to conceive earlier than that, I wouldn't do anything earlier than a year postpartum. But that year, we should be really, really focusing on replenishing those nutrients, getting those hormones good, and just building your body back up so it can be ready for the next ride.
Yeah.
But my
And
official
then
recommendation is 2 years between pregnancies.
okay. Yeah,
Doesn't
no, that
say.
makes sense.
Yeah.
Yeah. I feel like I've heard some people even say 3 years
Yeah.
in some cases, depending on
I,
the person's situation.
totally. Yeah, I think like 2 to 3 years, I think is a reasonable time that we, can explain as postpartum. And, it's going to go through different iterations in that time period. Some recent stuff was going around social media calling postpartum 7 years long. And I think a lot of people were resonating with that as because that's kind of how long it maybe took them to feel better. And I will say, as a mom of kids who are past that age, there's definitely like a parenting shift that happens around age 7, where like more independence, a little bit less like draining on you. And so I can see how that's a shift. But I think if we start calling postpartum, a lot of people say postpartum is forever, or saying it's a really long time period, like 7 years, that just extends the time where we're gaslighting women and saying, oh, well, you're still postpartum, so of course you feel that way. Or is this just what motherhood looks like at this stage? And without any kind of like curiosity and exploration about what might be going on, under the
Yeah.
hood.
Okay, that's super helpful. And so, coming back to symptoms, what
Yeah.
can you talk a little bit about the symptoms that someone might be experiencing that might indicate I mean, maybe that there's a problem or just these are normal postpartum symptoms? I think it's very
Yeah.
confusing for a lot of us.
Totally. And there's a gradation of these symptoms. Like a lot of people come to me for like unrelenting exhaustion. And, of course you're going to be tired, especially in those early days, especially if you're not getting good sleep, especially if you're still healing and in that more like 6 to 12 week period of time post birth. But there's a difference between like feeling tired as a function of not getting a lot of sleep and feeling like deep exhaustion to your bones, right? And so I think, when I'm working with a patient like that, I'm doing some testing. Like, what does your iron look like and your ferritin look like? What does your B12 look like? What does your diet look like? To see what more, physiological reasons could be contributing to that. But along with exhaustion, I do see a lot of anxiety. I see a lot of brain fog. Hair loss happens particularly around 4 months postpartum. And that's another kind of, we have a spectrum of normal. There is some expected hair loss to happen around that time period, but things like iron deficiency, a thyroid problem, protein deficiency can make it worse. And so in a lot of ways, the postpartum discussion around symptoms, there is a spectrum of normal and then okay, this is gone. This symptom has become more severe or has been going on for longer than we'd expect. And so we want to dig around and see what's happening there. So those are the most common ones I experience. Mood changes in general, kind of stress intolerance type stuff as well. Joint pain sometimes from that low estrogen and the still circulating there. So those are the basic ones I see.
Okay. Yeah, I think that's super helpful. And those can go on long term, right? If nutrient deficiencies and the stress and sleeplessness and all of these things persist.
Absolutely. Yeah. And they're just like vague enough of symptoms to not have a really obvious like treatment protocol, like in the more medical community. And so I see a lot of moms who have gone to their providers, with this list of symptoms. And I'm thinking of this like mom who's already super busy, super exhausted, just to get to their doctor's office might be this whole big thing, right? And then, maybe they run like a CBC and a TSH and then call it a day and give somebody like a thumbs up. And they're like, no, I still feel like absolute trash. Help me, what's going on? And so there's a really big gap there. And, in my view, I think it's a gap because it's not necessarily a medical problem. It is in large extent a nutrition problem. And so we got to see the right people to get the right help.
I couldn't agree more. That's why they need to see you.
Yeah.
Right. I feel
Come on over. Yeah.
Sometimes you have to deviate away from the conventional medicine path, especially in situations like what you just described, where they'll run TSH. And for anyone who doesn't know, that's thyroid stimulating hormone. That's the hormone that comes from your brain, talks to your thyroid. And that is not I don't think it's an acceptable way to establish what's going on with your thyroid at all. And I know you don't either. And so I feel like when you get that and everything comes back normal, you feel terrible. It's the idea is that's lazy medicine, right? You're not digging deeper. And it's such a fundamental problem that, I come across on a daily basis.
Yeah. Same. Yeah. And then it must be just me. Like, yes, I guess right. I'm not cut out for motherhood or, feeling like run over by a hormone truck, but I guess it's just my life now, right?
Yeah, totally. We 100% internalize it. I could not agree with you more. And then we make it our fault. Anyway, yeah. I know, yeah. Right? Yeah, we could rant all day. So can we talk a little bit about the fact that there's a lot of focus on nutrition for pregnancy, but we don't talk a lot about nutrition for postpartum. I feel like the baby's out and you're on your way and that's the end, right? It's really unbelievable. And until, I really looked at the topic for this conversation, I really didn't think too much about that. Like there really is not any conversation. I don't think I've ever heard anyone really say to me, anyone who I know who's had a baby, say like anyone ever recommended what they should do postpartum. I feel like it's happening now. But I would love for you to elaborate on the nutritional needs and awareness required for postpartum time.
Yeah. So the things that we're looking at are in the most immediate sense. Postpartum, we're looking at nutrients for healing, right? Because they're even, with an uncomplicated vaginal delivery, there is the wound from the placenta that's like a dinner plate size wound in the uterus. There's, any kind of like tearing that needs stitching exhausting. There's also just like the recovery from labor, which is like running a marathon, right? Depending on how long. And then of course, C-section recovery, that much more, right? And so there, extra protein needs, extra, vitamin and mineral needs to support all of that healing. And then we also just have higher increased needs for calories in general, for vitamins and minerals, especially if someone's breastfeeding. And so the nutrition needs, particularly in that fourth trimester, 12 weeks after delivery, are actually higher than they were during pregnancy. And that's not the message we get, right? We know that you're supposed to eat more during pregnancy to support the growth and development. But because we're like ghosting women on nutrition postpartum, I think the assumption is, oh, I just go back to what I was eating before, or maybe, oh, I can start dieting right away because I have all this extra. So I'm, like I said earlier, I'm definitely like good to go with like all of my micro and macronutrients because I have so much extra and I can just ride that out. And so in general, I'm looking at, 300 to 500 extra calories a day for the first maybe 6 months, where breastfeeding might be exclusive if somebody is breastfeeding. And that also helps with the healing. I'm generally having people aim for about 100 grams of protein a day divided by 3 meals. But, even without doing any like counting or tracking, because that gets really overwhelming and that's not necessarily something that I recommend in this stage. Just think like 3 big meals. And then if you're early in postpartum, we can add some snacks to those meals. If you're breastfeeding, we also want to add a snack or 2 to that, but really focusing on big meals. I like to do just equal parts starch, veggie, and protein. We're like hitting all the targets there. That really helps maintain good blood sugar control. So I find that often is the biggest difference that it makes in somebody whose chief complaints are exhaustion and even anxiety. The bigger meals with enough protein that allow for nice blood sugar control, total game changer in how somebody feels. So that's always my first step with people.
No, that's so, so good. And then I think about the fact that you've lost your sex hormones, which really help to, or they have an insulin stabilizing effect on your body. And then you lose all of that. So you're even more at a disadvantage if you're just like snacking and reaching for high carb foods whenever you get a chance to, like in between, whatever you're doing, napping and
right.
Yeah, you're napping, baby's napping, whatever, or
Yeah.
whatever you're doing, which I feel like is the common thing that I hear from women. Well, I'm just surviving. I'm just trying to eat here and there and eat whatever I can that'll give me the most energy.
Yeah, absolutely. And it helps in the short term, right? Like kind of like grazing and then you feel a little bit better after you eat. But I just find that leads to these big swings of blood sugar where I'm much more concerned about the crash and that, really exacerbating exhaustion. And it's a huge anxiety trigger for a lot. And it's one of like the more simple things to put into gear is the bigger meals 3 times a day versus the grazing, but it's sometimes a little shift with what's been going on. It's really common for somebody to be just having coffee for breakfast and then grazing throughout the day and then having a big dinner. And I find that's, contributes to that second wind at night, right? And then it's hard to fall asleep. And it's like, is that a second wind or is that a first wind? Because that's the first time you had a real meal, right? Is usually dinner. So having those 3 meals can be really helpful.
Yeah. Oh, for sure. I think about that all the time. I'm like, well, if this is your first meal of the day, you now have energy that you probably needed at lunchtime. Yeah, I know. Yeah. And I say this with no judgment because I've been there. It's happened many times in my life.
Yeah.
So I totally get it. What about supplements? So do you recommend supplements? And obviously anyone listening, this is not a recommendation for you, but I am curious what your thoughts are on supplementation to get through this time frame, because obviously it feels like a bit of all hands on deck situation.
Totally. Yeah. I think this is a time for some supplements for sure. I can send this to you. I have a supplement guide, a new mom supplement guide, where I have, I think, like 5 or 6 things on there, and like the full script links. So, if anybody is interested in that, but I do recommend a good quality prenatal, continuing it, at least 6 months postpartum, and then longer if you're breastfeeding. So the duration of breastfeeding, or at least 6 months postpartum. And, you know, a few brands I like Needed, Fullwell, Seeking Health, like the beefy ones that are like kind of quite a few pills a day, but they really help that replenishment, because we have a lot of nutrient deficiencies. You know, things like collagen can be helpful for that healing, in addition to getting, you know, enough protein. And then, you know, hormonally, like I think a nice, just kind of baseline gentle supplement can be maca, especially like maca powder, doing it in a food-based way. That can be really helpful at just kind of starting to support those hormones. And things like ground flaxseed. I find the combination of some maca and ground flaxseed to be helpful with those night sweats. And for a lot of folks. So not too crazy, you know, supplement wise, just like trying to cover the basics of supporting the physiologically natural process that's happening, right? Like we can't just skip postpartum and like steamroll it, right? You know, but you can feel better every step of the way if we're making sure that you're eating enough to support healing and to support what your body needs, you know, right now, to support all of the stress, emotional stress, as well as physical stress that's happening at this stage. And eating enough to support blood sugar, and then, you know, supplementing to help bring those nutrient deficiencies back up, and then a little extra hormone love.
Yeah, exactly. And so what do you do, or how do you navigate when women are really struggling with sleep, like their child isn't sleeping and and it's just, there's not much they can do, or they've tried lots of things and not working. How do you handle something like that?
Yeah. So I think the first step is how we can take a look at the schedule to get mom as many uninterrupted hours as possible. And that I'm aiming at this point for, if we can get like a 4-hour or even a 6-hour stretch of uninterrupted sleep for mom, that makes a huge difference compared to like 1 or 2-hour stretches, especially after it's been a while with maybe a baby that has a harder time with the longer stretches. So that usually looks like, you know, I'm sorry, but at 8 p.m. bedtime might be for you right now. If there, you know, is like a partner on the scene, you know, if mom is breastfeeding and can maybe hand off one of the feedings to partner so they can get that longer stretch. I think that can be really helpful, you know, pumped milk or whatever. And that can help facilitate that longer stretch. But then, you know, we're thinking about things like, how do we support the body's stress response? Because there's so much going on, you know, hormonally related to, you know, stress hormones, right? Like cortisol. And so we're taking a look at really making sure that we're dialing in those meals, because insulin resistance will definitely like creep up and be, you know, more difficult to manage the longer stretch of time somebody's going without sleeping well. You know, things like vagus nerve work, where we're just trying to really nourish that nervous system, you know, taking rests and be like restorative yoga poses. I have my patients do like legs up the wall pose once or twice a day. Like we can at least like try to like mimic those sleep hormones a little bit to kind of like again, nourish that nervous system and try to kind of like beef you up a little bit. And then also knowing that like there will be a time where this baby sleeps and
This time
hopefully you
too
will
shall pass.
too. Yeah.
Right.
And we're not going to do anything aggressive with weight management or anything like that while these foundations are so rocky. And so giving your body a little bit of grace and time during that situation.
Yes. Thank you for saying that. So good. I wanted to talk about the postpartum perimenopause overlap that you touched on earlier. And I mean, it is quite amazing to me how often I come across this now. And so can you talk a little bit about the fact that we're definitely in that overlap time where there are so many women waiting to have children. And so now they're like in the postpartum experience and in perimenopause at the same time. Like, how does one navigate this
Yeah.
hormonal landscape?
It's a special slice of hell, isn't it? No.
I know what it's like being in perimenopause right now. So yes,
right?
and
Yeah.
it's quite shocking. And I feel like I have done a lot to buffer myself.
Yeah.
So
Yeah.
I can't even imagine not having the buffer of these sex hormones that
Yeah.
you really need and want.
Yeah, exactly. So, you do such a great job, in all of your education of talking about perimenopause and the different phases. And, the take home message is that it's, a kind of stretch of time where your hormones start to kind of go down, right? Especially progesterone starts to go down, and then estrogen starts to do its roller coastery thing. And then, later stage where they're both down. And so if you we're already starting to head in that direction pre-pregnancy, which can start as early as like late 30s, right? So these subtle changes, but especially if like early 40s and you have a baby, your hormones are already starting to come down, and then they crash down in postpartum, and so it's going to be just like that much. Want to say harder. I mean, I do mean harder, but we have to be that much more like thoughtful at supporting these hormones so they can come back up, which means feeding them, getting enough food. Your hormonal system is not your body's first priority, right?
Mm.
So if you're not getting even just enough of the basic building blocks of what makes a hormone, like your healing, your heart, your liver is going to be prioritized over your hormonal system, right? So we got to make sure we're getting enough. And then stress reduction and making sure that you're focusing on sleep, all of those things. This is, I think, particularly kind of like a new thing that we see happening. So not a lot of people are, I think, like researching it or talking about it. But I definitely find that the moms that are coming to me after having a baby in their late 30s or early 40s or even mid 40s are having more symptoms. And that's because we have kind of like a two-hit system of things that are kind of like pushing down the hormones. Having a baby at 25, probably don't have too much to worry about. And in this case, the hormones come back a little bit better, a little bouncier, just like skin.
A little bouncier.
Yeah.
Yes, I would say so.
Yeah.
Not so bouncy at 43.
Yeah, exactly.
No, not so much. No,
Yeah.
that's super helpful to hear because I feel like there's so many inherent challenges with perimenopause, and there is such a lack of information, right? There's such a knowledge gap around what one should be doing to manage during this time frame. And then you put the postpartum time on top of that, where there's also so much or such a lack of information. There was something that you'd mentioned in your talking points prior to us recording about finding that women really needed the most hormonal help between the 6 to 18 month window during postpartum. And, I could just see how how defeating it must be for so many when they're in that perimenopause window, but they don't really necessarily even know that they are, because maybe they have been pregnant for 10 months, right? So their hormones have been great during the pregnancy. Right. And then I imagine it just exacerbates the crash and the symptoms.
Yeah, definitely. Definitely. And it's not to say that if you are on the older side when you're giving birth that you're just screwed,
Doomed.
right?
Right.
And
No, we
good
should
luck to you.
clarify.
But it just means that it's something that we want to pay attention to, and the earlier the better, right? And also, like, sometimes when I post stuff like this on Instagram, I get a lot of people saying like, "Oh, I wish I would have known this 4 years ago back," and it's like, it's not too late. Like, there's no window of time where you recover hormonally, and if you miss that window, too bad for you, right? There's always opportunities to feel better today, right? And it's just important to know the history, like what happened, what's the medical history surrounding your pregnancy and postpartum, and what are the symptoms now, and we can do some testing and figure out what the next step is. So it's not to be defeatist with that, but it is, I think, just to bring awareness that is, a special context where we'll need that much more help and support. The hormones need that much more help and support. But to talk about like the 6 to 18 month window, I don't necessarily think that that's like the worst hormonal time or anything. But what I find is that, if we take a mom that might be between 6 and 18 months postpartum, that didn't get any nutrition or recovery information in the first few months, maybe still isn't sleeping great, maybe stress is high, maybe still kind of grazing and skipping meals throughout the day, that 6 months plus time period, I think, is when it just like hits the hardest.
Yeah.
Your body can like really function on adrenaline for a little while. And I think that the immediate postpartum kind of looks like that. But after like 6+ months of kind of still not eating great, the hormones, the nutrient deficiencies, I think that's just where a lot of symptoms can kind of come to a head because it's been a while. And that's also the time, I think, where the expectations of, oh, I should be feeling back to myself at this point, I should be feeling better, really come up. And so the disconnect with how somebody thinks that they should be feeling, because I think postpartum is only 3 months long, because that's all we hear, and how they are feeling comes to a head at that point, and with these just like lingering symptoms.
So helpful to hear. Something we didn't cover was the thyroid and postpartum thyroiditis, and how that contributes to symptoms, and how the stage really can be set for that during pregnancy. Can you talk a little bit about that? I think that it's really important to cover because that, right? I think it contributes to so many symptoms that are often dismissed.
Right, exactly. I mean, if you look at a lot of the common postpartum symptoms, like, they can be explained by a lot of different things, right? Yeah. If you look at like the symptoms of hypothyroidism, and postpartum hypothyroidism is very common. I think they think about 10% of women experience that. And that's just the amount that's diagnosed, right? Who's, actually some labs were run on them. But, symptoms of hypothyroidism are going to be hair loss, low energy, skin changes, all of those kinds of things. And a lot of time, low mood, those are symptoms that are just like, oh, that's just postpartum, or that's just motherhood. And so we don't know to get the help. And then, you might not be getting too much help from OBGYN in that context either. But yeah, there's definitely some physiological changes that happen, with thyroid. I think that, again, there's probably a range of normal. If there were more studies on postpartum, we would know that a little bit better, but this isn't really like a hot research area. So I don't think we have a ton of data on that. But if we look at, just what's going on, from pregnancy to postpartum, and all the things that we know that your thyroid needs, right? And that exacerbates thyroid issues. Under eating exacerbates thyroid issues. High stress and cortisol issues exacerbate thyroid. Iron deficiency, zinc deficiency, other mineral deficiencies can really set the stage for thyroid issues. And that doesn't even bring up all of the like immune changes that happen. It's not uncommon to get a new diagnosis of an autoimmune condition postpartum, because there's so many, big shifts in the immune system at that point as well. And so that's just like another example of like, there's a normal and then there's a not so normal. And, I think that hair loss is a great example in the thyroid context, because it's just considered very normal to lose a ton of hair at around 4 months postpartum. And like everybody will tell you, oh, it's just the catch-up hair from you didn't lose a lot of hair during pregnancy, and so your body is just making up for it now. But we have to talk about like, these are the red flags if we've gone from normal kind of catch-up hair loss. I'm not saying like ketchup like on your hamburger.
Ketchup. Although they say it like that too, so yes.
Yeah. Or is it a problem, right? And so like, if something we want to get screened for, like if hair loss is feeling like coming out in really big chunks, you're starting to see bald spots, if it's lasting for, many, many months, we expect it to kind of peak after a couple of months and then see regrowth. So if you're not seeing any of that, all of that is a red flag that we want to look into your thyroid. Losing, outer third hair on your eyebrows is another sign there, or if you have any other signs of hypothyroidism. So it just like speaks to the kind of lack of testing that this population gets when they might present with certain symptoms, and a lot of them are just kind of written off.
Right. I think that is just extremely helpful and good clarification for what we should be looking for. We've covered a lot. This has been so good. Thank you.
Yeah.
Is there any final words you have for a mother? I swear, women are warriors. Damn, just listening to everything you say, it's really, you are all who go through the childbirth and raising of little humans it's very commendable. And navigating the shitty healthcare system and the gaslighting and the lack of hormones and all the things. It's totally no joke. So if there's any words of wisdom that you have for, as the final words of wisdom, that would be super helpful.
Yeah. I think there's a lot of discussion right now in the maternal space about like lack of support. Obviously, lack of maternity leave is on a lot of people's minds. And like the just moms in isolation and doing a lot of this on our own. And I want to say that like all of that is very true and can impact how you feel and impact your energy and your bandwidth and your mood. But it's also really important to look at the biological contributors to all of that as well. And I know that like if we resolve somebody's iron deficiency, if they had it, if we really help support the hormones, if we help support just getting enough of these building blocks, keeping blood sugar stable, it's so much easier than to kind of manage all the rest, right? And it's not just this all or nothing thing. Even when it comes to mood, I feel the same way. Like there's so many external reasons why, a new mom is going to have a mood disorder or might have a mood disorder. But there's also physical reasons and nutrient deficiencies and nutrition at play that contribute as well. And if we can work on the more physical things, a lot of times things get better, sometimes a lot better, sometimes a little bit better. But it's not this all or nothing thing where we think of just, we're stuck without support. And so we're never going to feel better. We can do a lot to feel better physically and energetically in that way. And it doesn't have to be hard, right? Just like first step, 3 meals a day. Protein, veggie, carbohydrate. Sorry. Some really good parting words. Equal parts protein, veggie, and starch. That goes a long way. So it doesn't always have to be this like really complicated dig in to find what's wrong with me. It can be really simple, and that can get you pretty far.
It's amazing. Alison, thank you so much. This is
Yeah.
really good. So informative. I would love for you to just tell my listeners where they can find you and your amazing work.
Yeah, thank you. My website's motherwellnutrition.com. You can find me on Instagram at b.motherwell. And then I can share these links with you. I have a program for postpartum called Mother Recover that really just guides you through the step-by-step what to-dos in this stage. And it was really good for somebody within about 2-3 years postpartum. And then I have some freebies too. I have a new mom supplement guide that I mentioned earlier, and I have a postpartum hormone quiz as well. So I'll give those all to you.
Great.
So yeah.
Amazing. Well, thank you again so much. I really appreciate you coming on the show and just sharing all of this wisdom. I am sure it'll be balm for the soul for many women who are in the postpartum time. So thank you. Thank you.
Yeah, of course. Thank you so much for having me and letting me share your audience and share what I'm really passionate about.
I can tell. You are. Thank you again.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.